Good afternoon, everyone. On behalf of Cytecare Hospital, I thank each one of you who have found time from your busy schedule in attending this discussion interactive session. Special thanks to our panelists. So October being a breast cancer awareness month, we at Cytecare have decided to interact with some of the women corporate leaders and use their experience and network to spread out the message about importance of raising awareness about cancer in general and breast cancer in specific. Because we all know the chances of survival are extremely high if we detect these cancers early, and more so in case of breast cancer, which obviously during the discussions we'll also kind of validate based on the experiences of the panelists. But we have found that this even after knowing the fact, the challenge lies in execution, and especially making women of our houses to agree to get them screened regularly or even speak about cancer. So the entire idea is to discuss the challenges associated with cancer screening programs in India, and how a corporate India or corporates in India can work with healthcare providers, including a hospital like us, can work together in addressing such challenges. So to discuss this interesting topic, we have three very eminent panelists with us, and I would be just not be able to actually do justice in introducing them in short span of time, but I have to do the duty. So the first of our panelists is Dr. Anurita Majumdar, who is an oncologist by training with 22 years in pharmaceutical and medical R&D sectors, including medical affairs and clinical development programs for both Indian and pharma MNCs. She has worked in global, regional, and country roles. Currently, Dr. Anurita is Senior Global Medical Affairs Director and Global Head for Respiratory and Allergy for GSK Pharma. In her 22 years of career, she has held various medical and clinical leadership roles in global as well as Asia, Africa markets. And she has worked in organizations like Pfizer, Eli Lilly, and currently she is in GSK. She also has an academic stint as a practicing radiation oncologist in Tata Memorial. And that's where we feel that her experience in working in one of the India's largest, or rather largest hospital, will also come in play. So she's a certified clinical researcher and has led early and late phase clinical development programs in diabetes and oncology. And she has been executive director and board of Pfizer India from 2016 to 18. And she's a very strong advocate of women leadership in science and health. So welcome, Dr. Anurita.
Thank you. Thank you, Amit, for that kind introduction.
The second panel member is Dr. Poovamma, who is a senior consultant and director of breast oncology at Cytecare Cancer Hospital. With more than 13 years of experience in breast oncology, Dr. Poovamma is one of the most senior-most and renowned breast oncosurgeon in Bangalore and in fact in south of India. She was the first graduate of fellowship in breast disease in India, and she is now in the faculty of fellowship in breast disease and cancer for Rajiv Gandhi University. She has specialized in aesthetically conserving breast for malignancies. Again, a strong advocate on focus for cancer awareness program. And Dr. Poovamma would have conducted maybe more than 100 of such sessions in last 10 years, not only for corporates, but also for educational institutions, resident welfare organizations, Rotary organizations, and her passion for raising awareness about the disease and to make an impact is second to none. So welcome, Dr. Poovamma.
Thank you, Amit.
And last, I would like to introduce Suresh Ramu, who is a co-founder and CEO of Cytecare Cancer Hospital, who is organizing these series of sessions. An IIT Madras and IIM Kolkata alumni, Ramu, as we lovingly call him, is someone who's fond of venturing into the areas of unknown, actually. Whether being part of a telemedicine startup in early 2000 or even kind of managing a cardiac safety unit, even though he's not from a medical background, to even setting up a clinical or a cancer hospital. He has managed large teams in Quintiles, India, so very well aware of the clinical research landscape. He has been part of some of the exciting healthcare and life sciences stuff in the last 2 decades. Apart from founder of Cytecare Cancer Hospital, he's also among the promoters of Cytespace Research Organization and Medwell Ventures, which runs the Nightingale Home Health Services in India. So welcome, Ramu.
Thank you very much, Amit. And it's my honor to be part of this panel with Dr. Anurita and Dr. Poovamma. Thank you.
Okay, so as I mentioned, I think the intent is to engage in some sort of a conversation, because all of us have had stints in corporates and in healthcare, including Dr. Poovamma, who herself is a breast surgeon, and kind of just discuss, because our audience, I'm sure a lot of people are urban professionals, many of these are women, and just try and kind of pass on some of the message, and also to try and kind of clear some doubts, if possible, during the course of discussion about what is the challenge that lies inherently with the cancer screening programs, or talking about cancer in general. I mean, we all know cancer is still considered as a taboo subject. So Dr. Anurita, maybe just to start with you. So maybe I should ask you that why India need to even focus on a cancer screening program? Means why are we talking about this screening program now?
So first of all, thank you, Amit, and thank you, Ramu, for giving me this opportunity, to speak in this forum. I'm currently based in Singapore, but of course, my heart lies in India, having worked there for 20 years. And I believe that Cytecare is really doing a great job by building this platform for creating awareness on cancer. And I'll tell you why. Not because I'm an oncologist, or not because I'm in the pharma industry, or I'm a medical professional, but chronic diseases has really, the mortality rate for all chronic diseases has increased in the last 2 decades. And when we talk of non-communicable diseases, cancer is one of the biggest killer, right? And I still believe that even amongst educated urban population, the awareness about cancer is very less. Right. I still see that when you go to hospitals for screening programs, the natural screening program is cardiovascular and diabetes. And of course, it's important. India is the diabetes capital of the world, and there should be screening. But if you look at the National Cancer Registry report of India, 2020 report, it shows that the incidence of all major cancers has increased. Actually, 1 in 9 Indians now have a chance of developing a cancer in their lifetime. And if you talk of breast cancer, because October is the breast cancer month, at the time when I was studying cancer, cervix cancer was one of the largest cancers amongst females. Breast has clearly overcome that, not just in urban, but overall. And almost 1 in 28 females have a chance of developing a breast cancer. We also know, and of course, we have the oncologist here, who's the practicing oncologist, who could probably give you better information, that if detected early, the treatment success is very high. And hence, there is a need for a robust, comprehensive, and sustainable screening program for cancer, for all major cancers, but particularly for breast cancer, because we know that early breast cancer has a fantastic prognosis. It is important because, women are the lifeline of the nation. And if we encourage such screening programs, we are really going to, add volumes to the health of the country. So that's the reason we should have a very, very well thought out screening program.
Thanks for listening out. As you mentioned, the data speaks to itself. We actually tend to underplay the risk of cancer, or probably what is facing us, but we just can't run away. So it's kind of facing us on the face. So Dr. Poovamma, just maybe building on this, you being a doctor, and you have, as I mentioned, probably you have done more awareness sessions than any of us. So normally, what challenge do you see as a doctor in convincing a healthy woman to undergo a breast cancer screening? And why do you feel, what's the problem?
Hi, Amit. And I think it's good that we're conducting more of these breast cancer awareness sessions because um, how many ever we how many ever sessions we have, I think it's still insufficient. I liked one of the points Dr. Anurita pointed out that, it's not just about knowing, even educated women don't come for screening. Forget screening, educated women come late with stage 3 and stage 4 breast cancers because they don't realize the importance of early detection of cancers. I have had patients, highly qualified advocates and whatnot, who've had symptoms, and then there's a huge time lag between the time they come, from the time they have detected the lumps or a difference in the breast to when they're present in the hospital. So I think the main challenge is there's a huge disconnect about what we know, but what we do or follow in our life. And I would say the most important thing about creating awareness about breast cancer is not just about breast cancer and symptoms of breast cancer, but also about stressing on the importance of early detection of cancers, because there's a huge way women would deal with when they are detected with early breast cancers versus late breast cancers. Early breast cancers have a high cure rate, more than 95-96% cure rates, and this gradually drops to less than 20% when detected in stage 4 or when cancer has spread. I think the other problem is also that breast cancer doesn't really create problems. It's just a very silent killer, something like a diabetes or a hypertension. They just have some symptoms in the breast, but they don't have any kind of systemic symptoms. And we still hear that in OPD. I don't feel sick, I don't feel unwell, and you're telling me I have a stage 3 or a stage 4 breast cancer, and how could that be? So I think the key important over here is we have to spread the message that early breast cancers have excellent long-term outcomes, with 20-year survival rates being more than 80%, say, versus a stage 4 breast cancer, which has a survival rate as low as 20% for 5 years. And screening, again, what happens with screening is because they're completely fine, it's like, it's not broken, why fix it? So people don't want to take the time out to come into the hospital. There's a lot of myths and misconceptions about mammogram, exposure to radiation. They think it's very painful to undergo a mammogram, which is actually not true. And the radiation exposure associated with mammogram is very low. So I think maybe with a lot more educational activities, creating more awareness, and also awareness in particular about early detection of cancers, and especially breast cancer, is very important, because from the latest data we have, we know that breast cancer is the most common cancer if you put both men and women together. It's a leading cause of cancer in India. And it is said that breast cancer is the most common cause for death in the women in the age group of 35 to 54 years. So you're talking about young women who are at the peak of their lives, careers, whatever, when the family needs them the most. And that is the time when a lot of time is lost. Women are diagnosed with stage 3 and 4, and we lose these women. These women will die with advanced breast cancers. It is a challenge, and education is really not a guarantee that somebody is aware and somebody is going to come in. So I would say just creating awareness for everybody is important.
Thanks. Thanks, Dr. Poovamma. So as you mentioned, education is not the guarantee. In fact, that's why our focus this time has been on the urban settings, because we really feel they really need to understand. Sometimes education actually creates a hindrance in mind. So totally understand. And so Ramu, coming to you, it's not something. This same question is being asked to you first time. I'm sure it has been asked multiple times. That why a corporate hospital, like yours, should be even bothered about raising awareness. What you are trying to do is to actually prevent a disease, whereas the commercial lies in the treating the disease. So, why are you so passionate and involved in spreading awareness and more so about screening?
Thanks, Amit, and thanks to all. I think the importance of early detection And the importance of screening, therefore, has been highlighted by both Dr. Anurita and Dr. Poovamma. I think a hospital is fundamentally a platform, whether it's a private hospital or a commercial entity or a public hospital or a trust hospital. Hospital is for the community, it's for the service of the community. And I think that's fundamental to a definition of what we believe a hospital has to do. The second part is the expertise of oncology. A significant part of the expertise of oncology treatment is within hospitals. So if you have to talk about oncology, you have to utilize the platform that the hospital has and the expertise has, because you bring credibility along with it when you have senior surgeons like Dr. Poovamma when they talk about oncology, because that is what the hospital has as a benefit. The third is, I agree with you. I think hospitals have largely focused on the transactional and the commercial. It is expensive to do awareness. It is expensive to do a screening, mass screening, etc. And we do look forward to support from a large number of entities to help do these exercises. But hospitals are also places where societal impact can be created, right? I mean, that's really the role of why Cytecare exists. So beyond the commercials, we have to ask ourselves, why do we exist? And are we creating the impact that we are that we set ourselves out to do? And what is the right thing? And when we look at the treatment life cycle, the costs of treatment, Dr. Poovamma already mentioned about survival and quality of life rates, for patients who are detected late. It is very obvious that the early detection is going to save lives, is going to very often keep the women and men productive, which means that the net cost outflow is significantly lower for them, even if treatment is given early, for early detection. So it is huge in terms of the impact on society. Also, I think that there are now treatments available where you can cure these cancers, right? So there is a lot more hope that a hospital can give by actually picking up the cancers very, very early. And I think, therefore, I would say it's very much in our charter to support, to actively participate, and be involved in raising awareness and do a lot of these screening programs. In fact, we have now launched a sub-brand called Foresight, playing on the word CYTE, to say that we need to do health checks and early, which is really the foresight that everybody should be looking at to protect themselves and their family members.
Thanks, Ramu. My next question to Anurita. Dr. Anurita, you've been part of the corporate world, and Indian corporate world, for more than 20 years now. You have seen, and you have been part of the initial the clinical settings in Tata Memorial also. So what's your view in terms of awareness among the urban working women? Maybe if I ask you to reflect maybe two decades back, so do you see some positive signs, or are you kind of disheartened with the current situation? And I just wanted to have your view on that.
Yeah, so Amit, I think Dr. Poovamma herself mentioned that in her conversation, that the awareness amongst urban educated women for cancers is certainly not very high. And this is despite the fact that in the last decade, several awareness initiatives have been taken. So, you have the pink cancer, the pink color associated with cancer awareness. You have marathons being run for cancer awareness. And, you have a lot of screening programs that has been started. Mammography, is now available in all hospitals as part of the routine screening. Despite that, within my circle, within the people that I know, I really don't find people on their own opting to go for a screening program, right? Usually they will go for a screening program, if it's required for some health insurance or something, but on their own, I don't see that. And this is something that has really not changed. 20 years ago when I was in Tata Memorial Hospital, even then, we used to see educated urban women coming with advanced cancer. And now it's been validated, right? Dr. Poovamma just now mentioned that even now in 2021, where you have so many celebrities advocating for it despite that. So I just believe that the awareness level has not really improved. Yes, it may have, the needle may have moved, but it's really not significant enough. And, again, if I talk about data, and I'll talk only about India, I saw in the same report that, almost 60% of the breast cancers are detected when they are locally advanced or metastatic, which means stage 3, stage 4, which clearly means that this, the screening programs, whatever it is not effective. People are not coming forward for it. So I think the short answer is we don't have that awareness. The awareness that is required to detect early, then the statistics would have been different, right? The statistics would have said that, okay, 70-80% of cancers are detected in early stage, which is not there. And hence, I really don't think that the awareness has, improved. And I believe a lot more needs to be done. And I'll just talk about one more point. We talked about, educated people not being aware. My experience, not just in cancer, but also in diabetes, because I was associated with diabetes education, it's more difficult to educate adults, right? And even though our target today is to look at the adult urban woman, which is important, I believe education for chronic diseases needs to start at a school level, right? At a very early stage when they are still, people are still students, right? Because I guess that stays on in the mind. Adult education is extremely difficult. It's not easy to change habits. So that's, I think, my assessment.
I think thanks for getting this. In fact, that takes me maybe to jump and move to Ramu, because as you mentioned, I think it's something like that. It's kind of imprinted in the adult mind, and Ramu and we all, in fact, are very, very passionate to change this at least in the future course of time in whatever way possible. So Ramu, maybe I'll kind of put the question, and you can definitely share some of the experiences that Cytecare as an organization and maybe as an individual also you have, in terms of broadening the stakeholders in the entire ecosystem of spreading the awareness. Because till now, we try and just focus only on say, like women we are talking about. But as Dr. Anurita has mentioned, they have probably gone beyond that level of understanding. So you have to maybe increase the funnel. So maybe just a little bit about your initiatives, your ideas on increasing this entire funnel, or increasing or going into the more stakeholders.
So, talking to adults obviously is important because at least they are not ignorant. So they become more aware of the fact that there could be, cancer is something that can affect them. They can take care of it. They can do early screening, and it is not painful. It is good for them. The myths of cancer screening can be busted, etc. So that, I think, is in any way an important activity. And therefore, if you look at the stakeholders who should be involved in it, where is the expertise to do that? I think obviously the healthcare sector, the delivery sector, the hospitals, the oncology players, biopharma companies, the diagnostic centers, wherever there is expertise, I think there is a fundamental responsibility in my mind that all of them have to spend some amount of their time in building awareness, because they know more about the disease than anybody else. And I think that kind of is a privilege, but also is a responsibility, I think, that is there on all of us, especially those in the healthcare sector. The government bodies obviously have a huge role to play, because a lot of the screening can be done in primary settings. It can be done in a low-cost setting with clinical breast examinations, maybe for breast cancer, for example, or oral screening for head and neck cancers. You don't even need diagnostics for a lot of these to pick many of these cancers early. Of course, there are some that you cannot without appropriate diagnostics. But I think the larger point I'm making is that the primary healthcare setting needs to become a lot more active in almost enforcing this down the line to do early screening. So when we're looking at government programs like Ayushman Bharat, I think a big emphasis of that program, in my mind, should be in deploying these in the primary health settings and in actually making this available for a large number of people. And I'm not talking about rural, as has already been made. I think this is applicable to the urban educated class as well. I think the political leaders, national leaders, also obviously have a great standing. They can also influence a large amount of the population because there are followers. I think we have seen a large amount of the film stars, celebrities also endorsing it. And all of that, I think, is important because people will listen to them when it comes from credible sources. I think not-for-profit organizations like Indian Cancer Society and many others are also actively involved, and I think their contributions are significant in already raising the levels of awareness. We have seen uh, cervical cancer becoming less prevalent or reducing in its prevalence. Hygiene has improved. Early detection has improved definitely in India because of some of the programs that have been run by many of these not-for-profits. Anti-tobacco lobbies can play a huge role. We know that tobacco has a huge role in some of the cancers, particularly head and neck and lung. Though we're talking about breast today, but I think tobacco has a far-reaching effect on a large number of cancers. And I think, again, there is a lot that we can do on that front to educate people about the impact of tobacco. And the point that Dr. Anurita made is something that is our realization as well. While we continue to talk to adults and we talk to people who are potential candidates for screening, can I say that? But early education of the fact, the importance of the awareness of cancer as early cancer detection can be done in schools and colleges. And our experience here has been very, very positive. We've engaged with a few schools nearby to Cytecare in Bangalore, and we have seen tremendous participation, involvement, and creative ways of communicating the message. And I think everybody knows, I guess, on this call that, and the call, the people who have joined, that cancer can be picked early and cured. The action around it, to actually do something about it, to actually go and do a health check every 2 years, and to continue to do a clinical breast health examination rather, is something that I still feel is a big miss. And why does that happen? What is the fear? What is the stigma? And I think children and young adults may have very, very, very creative ways in which they can make an impact. And I really think that we all need to encourage this amongst the younger ones to figure out how do we communicate to us adults and get us out of that fear and the stigma syndrome that we have to do the early cancer screening.
No, and I can second that experience of working with schools, having myself personally involved in some of these initiatives. So I always give an example of a great institution like Vidyashilp Academy, which is very near to our hospital. I mean, just a few months of engagement has done wonders to that extent that kids not only actually motivate a lot of the stakeholders within their own community ecosystem to go for some of these screenings. They have also established a cancer support fund for supporting cancer patients. And we know, I mean, in last 1.5 years of that fund operation, they have actually supported close to 12 to 13 patients. So amazing impact in terms of talking to some of these young generation. So maybe just going a bit on this same only, Dr. Poovamma, since you engage a lot with the healthy people out there and trying to motivate, one normally fear that people have, especially women in the age of 40 and above, have about going screening and doing maybe the mammogram and some of the associated fears. So just a couple of words from you just to reassure them. What would you say that why should you do it?
Yeah, there's a complete myth about mammograms and screening with that. First of all, women think that it's going to be very painful to undergo a mammogram. They think the radiation exposure with mammogram is very high. So that's kind of one of the myth which is there, and we kind of always shatter that and say the radiation exposure is extremely low. and it's equal to background radiation, what you're exposed to. But I think to get women to actually go for screening, to motivate them for screening, I think awareness is what is the key. And here I want to pinpoint some of the data, because invariably women think, cancer is a disease of the older population, and I'm kind of too young to develop cancer. And breast cancer in India is very different from cancer in the West. So it is proven that breast cancer occurs a decade earlier in India compared to the Western population. And though the incidence of cancer in India is not very high compared to West, like, in the West, they say 1 in 8 women will develop in their lifetime breast cancer, whereas in India, it's about 1 in 22. Yet mortality in India is very high. For every 2 women diagnosed with breast cancer, 1 dies. And that's because most of them are diagnosed in stage 3 and stage 4. I think that's what is important for us to tell us early detection is the key. And we have data telling us, when tumors are detected very early, less than 1 centimeter in size, the 20-year survival is more than 90%. Versus I'm talking about advanced breast cancers, which have a survival of 20% for 5 years. So I think awareness ultimately will be the key. We have to start young. Many a times it's children driving the parents to go in for a screening, and we see an alternate in that, in the sense of the middle-aged people do not bring their mothers for screening, because they say, oh, they're fine, why should I take the mother or the grandmother for screening? So I think if we start young, we're going to have some kind of result somewhere down the line where we have children motivating their parents to come in for screening, and that is important. So I think engagement with women is important. Probably also giving them time to go out to get the screening done is also important.
Yeah, totally agree. So Anurita, maybe just build on that, since you represent the corporate India and maybe leadership in the corporate world. What according to you, is something definitely corporate has some responsibility. We just can't run away from that. So what are the few things that you feel that corporates in India can do or should do to raise maybe awareness about this disease, or maybe even the non-communicable disease that you mentioned? So maybe your view on that.
Yeah, so Amit, this is a very good question, because I can tell you that the corporates have a very big role to play. So, let's divide the corporates into 2 kinds of corporates who are into healthcare. Okay, so if I talk about pharma, since I'm part of pharma, right? Healthcare is not just manufacturing, developing, and selling drugs, right? Healthcare is basically to partner with stakeholders to create an ecosystem for improvement of health, right? So in that perspective, I think corporate has its own women workforce, and many corporates now in the urban cities have a significant women workforce. And since we're talking of breast cancer, that's why I'm talking of women workforce. So they certainly can improve awareness amongst its own women workforce to go for routine checkups, right? Which includes screening programs. Almost all corporates in India are now providing annual, medical support for its employees, right? Those annual medical support should include a screening package, right? Depending, of course, on the age of the employees, whether they are above 40 or below 40. But that screening package, in many cases, do not include a cancer screening, right? And if you think, if you see in India, people will just go for what is there in their package. They would not probably then go out of their way to include something. So what corporates can do is that they should include cancer screening, let's say for breast cancer, mammography, and all in the package, so that women can get into those screenings. So that's one. The second is that corporates could create awareness drive again for its own employees, and this is for all employees, because whether they are female or male, the male employees have their spouses, they have their sisters, mothers, right? And that awareness drive could happen with experts, medical experts. So they could partner with hospitals, right? They could partner with hospitals to actually have their employees go to the hospital for screening, or experts such as oncologists, such as Dr. Poovamma, could go and deliver those lectures. So when I was in Pfizer India, I can say Pfizer India did that, for all its employees once in 6 months, would invite some expert, or once in 3 months. It could be a cancer expert, it could be a diabetologist who would come and give those talks, and then those would be very, very motivational. So that's, I think, what corporates can do for their own employees. Then apart from its own workforce, so all corporates have CSR funds, right? And there is a mandatory CSR spends for corporates who have a certain revenue base and above, right? So some of those CSR funds could be channeled towards cancer screening program, right? And this is very important because healthcare is underfunded. Public funding in healthcare in India has been low all throughout. We know that. And it really got unearthed during this COVID pandemic, when we realized that, what situation India's infrastructure and health infrastructure is. And in that case, corporate can play a major role. They could support through their CSR funds, either support hospitals or support academic institutions through these awareness and these screening programs. Well, I think it's well known that Tata Memorial Hospital, a large part of cancer screening program has actually come from such kind of funds, right? The Bill Gates Foundation, for instance, supported the entire cancer screening program in Barshi and all for cervix. So those, but that's just Gates Foundation. Indian corporates are very big, and and I'm sure they must be doing, right. And I'm not saying they aren't, but I guess there is more that can be done, and awareness around this needs to be created. So perhaps partnering with media to actually create that awareness so people know, right, what corporates are doing, but also people could avail of those benefits. So again, in a nutshell, I really believe that corporate India has a big role, and not only for cancer, but overall for non-communicable diseases. Because if you see that, even though we are all worried about the COVID pandemic, but it is the comorbid conditions which is making the patients become critical, right? And comorbid conditions are what? They are NCDs. Most of them, it's the immunocompromised patients suffering from diabetes, hypertension, cancer. They are the ones who are, more likely to get the serious disease. So this is a syndemic, as I call it. The NCD and the communicable disease, they exist. And there is an interplay between that. And hence, I think it's important that, corporates form a part of the ecosystem, partner with the healthcare professionals, with the hospitals, with the government, right, in improving screening programs, including breast cancer.
No, very valid point, Anurita. In fact, that's our intent in terms of involving with leaders like you, and we will definitely spend more time and effort, even getting more input on this subject. But thanks for your input regarding this. So Ramu, maybe just taking from the same points. I mean, why screening by corporates, or what should corporate do? But normally in our discussion, we have heard there are actually skepticism against the screening program. Somebody says the risk benefit analysis, there is very less detection. So what would be your response to those cynics out there? I mean, I in a single word respond, even one life saved is more than anything else. But I would like to hear something from you against these things.
Yeah, I mean, I was going to say that. I mean, I think one life saved is far more valuable than many that turned out to be negative. And I think it's good to know that there is no cancer, at least at that time point, for that individual. And I think that information is also important. And one of the senior oncologists once told me that it's not only the positive or negative data point that comes out of a screening that is important, it's also trend lines of information that is important. The fact that one has a mammogram 2 years ago and nothing was detected at that point of time, and now there is something that is looking suspicious, let's say, is an important input in terms of not only the current state, but also the fact that something has developed possibly in the last 2 years, and that time frame is an important input to the oncologist for defining the treatment plan. So we are picking up trend lines using the screening data, and not only the static information about whether or not you have cancer. And I think this is something that needs to be emphasized over and over, that we need to continually have our health records maintained. We need to know that there is a periodic check, and during those periodic checks, we are we find ourselves healthy, and or we get guidance in terms of how we can improve our lifestyle, or we identify certain risk factors that we need to watch out for. And I think that those are the key deliverables I see of a screening or a set of health checks that we do, versus the only the definitive yes or no answer that we typically we want to see. And nobody wants to know that you're unwell. Actually, I think the big part of health checks is the fear that or maybe even the bias, or maybe the commercial bias, as Amit, you had started off saying, hospitals will try and find something. The doctor's going to find something in the health check, and I need to now deal with it. I'm actually absolutely fine, and I don't need to go for a screening. That kind of a bias is also impacting the fear in adults to actually go and do their screening program. And I think we need to really focus on the fact that it can be done quickly. It is non-invasive mostly. You can continue your day schedule. After that, it's a half-day break to know that you're doing fine. And one half day in a year is an investment well worth it. So I think these are what I would say from a screening perspective that we need to communicate.
No, totally agree to the points out there. So, I mean, definitely worth an investment, but it's easier said than done. I mean, we have discussed multiple times. It's even difficult to even convince ladies of our houses to come to the screening programs. But I'm hoping some of them who would be listening to the eminent doctors, they would probably be convinced. So, Dr. Anurita, maybe since you have a very broad or a kind of a deep experience in terms of clinical research also, and you worked in the commercial organizations. So maybe just touching a bit on the clinical research or importance of clinical research in the cancer care space, and how do you think maybe India can play a role in that? Because many times it's actually difficult to convince a patient for being part of a clinical trial, where as a professional, we know that how advantage it is for that particular patient or a family. Maybe your view on that?
Yeah, so see, I think India has been playing a very significant role in clinical research, in the last 2 decades, if I may say so. But even though compared to the Western world, the number of people in India who consider themselves, interested to participate in clinical trials has always been less. And that is again another area. So it's a full separate subject altogether, where you are aware, right? You've been part of the clinical research industry, and so has been Ramu, that there has been so much taboo because the way media showed, right? Clinical research is shown as being guinea pigs, right? So that's a complete different subject. But yeah, coming back to breast cancer, I think most of the big multinationals in India, they have brought in the cancer therapeutics pretty early in India, right? Whether it is the Indian pharma like Dr. Reddy's and all, or it has been multinationals such as Pfizer and Eli Lilly's and GSK's of the world, right? They have. And this has been possible only through clinical development, right? Because in India, it's mandatory to do a phase 3, right, to get your product registered in India. So that's very clear. So if India wants to get early treatment, or a drug which is getting developed or just getting approved, if it has to get launched in India, then clinical trial is the only way to get it. And that's why, to avail of the best treatment, and that's already happened. So, for most, the biologics for treatment of breast cancer, all of them have been researched. So I guess in a nutshell, because this program is for awareness of the general public, first is clinical trial is a very well regulated process, right? And it is the only way where you derive evidence of what therapy is working or what's not working, right? And especially for cancer, I think it's very important because you need the latest advances in therapy. And if somebody is eligible for clinical trials as offered, they should consider participation by reading the consent form and of course, joining that, because that's the only way we are able to contribute towards new therapy. So that's my view. And it's not just about cancer, it's for every disease. Today, if we're talking of vaccines, everybody wants to get the vaccine. A vaccine was made possible because people volunteered to contribute in the vaccine trials, right? So those people who contributed, they actually contributed to getting the vaccine. It's not just the manufacturer, it's not just the government who's funded it. It's those volunteers who've participated in the phase 1, phase 2 programs, basis which the emergency use authorization was granted. And now millions of Indians, or millions, billions of people all over the world are getting protected from COVID because people participated in clinical trials, right? So that is, I would say, the importance of clinical trial. Of course, the same in the context of cancer.
Oh, thanks. And as you mentioned, probably pandemics has really shown the world the importance of working collectively, cohesively, and at a swift pace. I mean, coming out of vaccine in a span of maybe 12 to 14, 15 months is unimaginable when we started our careers in clinical research, maybe a couple of decades back. So, Dr. Poovamma, maybe just coming back to a little bit on the clinical side and some of the questions that normally you face, or how do you respond to that? Because, say, we have heard a lot about the importance of a multidisciplinary tumor board in cancer care, which including a breast cancer also. So what's your view on the importance of such tumor boards out there in the clinical kind of governance or in the treatment cycle of a patient? So maybe your view on that.
So most often, especially when you're talking about breast cancer, we treat breast cancer with multiple modalities. It's not just surgery. It could be surgery, chemotherapy, radiation therapy, targeted therapy, immunotherapy. And breast cancer is not just one entity. There are different subtypes of breast cancer when you look at the molecular level of the tumor. So I think what a multidisciplinary board does is, instead of the patient hopping from one room to the other, another room to another to get different perspectives, treatment is planned and tailored to the individual in the tumor board, in the multidisciplinary tumor board. So you get a perspective about the patient, about their comorbid conditions, about what kind of cancer they have, and everything is discussed at one sitting with, with people who are eminent in their own fields. Like the medical oncologist is involved, the radiation oncologist is involved, the radiologists are involved, the surgeon is involved, the pathologist is involved. So everybody sitting together and discussing one individual patient or every patient that we're going to potentially treat, and everybody giving in their inputs. I think with healthcare, the margin for error is very low, and I think the multidisciplinary board adds to that to decrease the rates of error which can happen with just one person making decisions. And I think that's what this contributes. The multidisciplinary board contributes in helping to make one holistic, comprehensive treatment plan for every individual, where the treatment is tailorized to their age, the kind of cancer they have. You look at the patient in a holistic manner. So everything is touched upon at one go, instead of being bits and pieces and making the patient hop from door to door, contacting different doctors and getting different opinions. Many of times we have different opinions ourselves. So all the clashes happen in the tumor board as to what is the best form of treatment for the patient. I think it goes a long way in giving the patient the best treatment available as of today.
No, I totally agree. I mean, rather than a single or a couple of doctors deciding, it's the 20 brains and the best of the brains, possible brains, discussing it would definitely improve the outcome. So thanks for re-emphasizing the importance of tumor board. So Ramu, maybe just tumor board is an inherent part of Cytecare, and we are proud of it. But just going back, you decided to set up a hospital. So any specific reason that you wanted to set up a single specialty cancer hospital, which is against the trend of setting up a corporate hospital, which is mostly multi-speciality? So why do you say that we need more of single specialty hospital in a space like cancer care?
So I would answer this in a few parts, actually. Number one is the burden of cancer is increasing in the country. So I think there is a need for specialized cancer hospitals in the country. World over, you see that the cancer, even if it is part of a system of multispecialty, it is separated out because of the fundamental thing that Dr. Poovamma mentioned, that cancer is not one disease. Actually, it's a group of many different diseases at the molecular and biological level. It has different organ sites that can be involved. So in many ways, actually cancer is only a generic term for a group of diseases. And it needs the so-called multi-specialty approach, but with focus on oncology. So the growth in the burden of cancer, the fact that there is a need for good hospitals in the city of Bangalore as well as in India, that focus on cancer and provide this holistic approach that are focused on clinical governance in terms of what is right for the patient, kind of prompted us to do something in the space. And you can create that whole thing under one roof. I mean, for the patient. I think that is a big part of. So the patient doesn't really need to move around. You have nuclear medicine, you have radiology, you have radiation therapy, all in one place. You have the surgeons who are practicing for 15 to 20 years in the specific organ. Obviously, that is enormous amount of expertise that you're bringing in for that specific cancer, whether it is head and neck or breast or gynec or GI or ortho or neuro or uro cancers or hematological malignancy. So you bring in enormous amount of expertise, which is, in my opinion, not very easy to do in a multi-specialty setup. So while our hospital has expertise across specialties, our focus in many ways, and therefore our investments, and therefore the ability to create better clinical outcomes significantly improves if we are focused on a group of diseases like cancer.
Oh, thanks. I think that really kind of answers the thought process or the case for setting up these. So, Dr. Anurita, I mean, since you have been part of the clinical, the cancer space for long, and you have also worked in multiple geographies. You have visited and been part of some of the trials which are associated in multiple specialized centers. So, what do you feel is kind of lacking in the corporate settings in India in terms of the cancer space? Is it focus or is it some? I mean, I'm just asking. Is it even some sort of a lack of the best of the talents when we talk of some of the locations? So maybe some of the bigger cities, they are able to attract talents, but as we go to maybe tier 2, tier 3 cities, it becomes a problem. So what inherently means couple of points that if you can come think of in terms of the problems which are associated with the cancer space in India.
So just to understand your question correctly, are you talking about the corporate setup for clinical trials? Yeah. I think talent is certainly one of the reasons why most clinical trials are set up in major cities. But it's not just about I guess talents alone. It is also about working with hospitals. For instance, when you have to do a clinical trial in cancer, right? And if I've understood your question correctly, it was more about the clinical trial space. Then you would like to go to a specialized hospital, a hospital associated with cancer care. And those are, yes, it's increasing, but yet they are still concentrated in certain cities and all. I guess that could be a reason why it's largely concentrated to the urban setup. But look, I have not really been very closely associated in the last few years, but I believe that this trend is changing now. But even, let's say, when I was running a cancer trial in 10 years ago, right, when I was in Eli Lilly, let's say, we did have almost 10 sites in India, and not all of them were in big cities, right? So we did go to tier 2 cities also, and there were very good enrollments. So I think that is there, like the hospitals have really come up, but if the clinical trial organizations who say they have concentrated to big cities, largely perhaps because of talent perspective.
Sure. So maybe one last question, Ramu, before I take any audience question. And I think we have more or less covered everything. So I doubt there are much audience questions will be there in this area. But what role do you envisage for Cytecare in getting some of these global treatments modalities for India in coming years? And we know some of them even could be in the clinical trial setting. So your view on that?
Yeah, so we've been involved in clinical research almost from year 2 onwards. Now we're completing 5 years of operations at Cytecare. Year 2 onwards, we got involved. We set up. We've got an excellent ethics committee team that reviews the protocols. We've now conducted maybe over 10 clinical trials at Cytecare already. So being involved in clinical research and clinical trials, I think gives access to what is the latest and what is the cutting edge that is happening all over the world. Access to that to our clinicians, and I think broadly improves the standard of care that we are able to provide. There is a lot that is happening because of our understanding at the molecular and the cellular level in terms of how cancers are behaving. And I think this knowledge, coupled with diagnostics, coupled with that fact that now we have drugs that could actually be targeted to treatments, is something that is very exciting in the space of cancer. And we've already seen a lot of that in the last decade, but I think the next 8 to 12 years is going to be even more exciting in my mind, with a lot of new therapies that are coming on board. So this is an ever-evolving space. We have not yet solved for cancer. We have, there's a lot more cancer cures that are available if detected early. But I think there's a lot more promise that is coming up in terms of being able to understand how the disease evolves and what can be done. From a technology perspective, there's already a lot in terms of lasers, in terms of robotics, in terms of transplants. A lot of that is already available. Nuclear medicine is advanced quite a bit, and there's a lot that we are able to offer. Radiation, of course, is advanced quite a bit to make it precise. A lot of the surgical techniques have become very, very precise with intraoperative radiology and diagnostics. So there is a huge amount of positive change in terms of precision and care. I would still say that at a very fundamental level, though, we need to remain focused on what the patient really looks forward to from a holistic perspective, both from a psychological perspective, from a care perspective, from what they believe is important for them, not only the clinical aspects of care. And I think that is what we're trying to balance out at Cytecare, both the expertise and the technology, of course, but also what are we doing on the care side to improve the experience for patients.
Thanks. So one question I see in the chat, maybe Dr. Poovamma can answer that. So to define early breast cancer, is there any specific method or tool to define or measure? I mean, how do you define or how do you qualify it as an early breast cancer?
So to say early breast cancer, we mean cancer that's restricted to the breast and not spread to the adjoining organs or the adjacent lymph nodes. So that's early breast cancer. Early breast cancer is cancer, whatever the size, ideally restricted to the breast, not spread to the lymph nodes. Those set of tumors have the best long-term prognostic outcomes.
And maybe just to add on that, what's the earliest age that normally a person or a woman can catch breast cancer? I mean, as you sometimes mentioned, there is a misconception that it's only a disease of elderly.
So I think there's really no age criteria for to develop breast cancer. If I just look at Indian statistics, nearly 48% of breast cancer in India is occurring in women less than 50 years of age, and we're talking about screening only after 40. So 24% in between 40 and 50, about 16% in the 30s to 40s, and about 4% in the 20s. So you can see that, we say breast cancer, older women, but if you go down and look at Indian statistics, 48% less than 50 years of age. So there's really no age where you can say you don't have cancer. I've had a 15-year-old with a benign lump excised because it was large, showing a little unusual features, which was harboring low-grade malignancies. We have women, very often we have a lot of women in their early 20s. So that's why when we talk about awareness, I always emphasize that anything different, anything new in the breast has to be evaluated. And though, most lumps in the breast may not be cancer, but it's always better to get it evaluated, rule out cancer, and then go on, than to neglect it. And I think this bias is also there in doctors. It's not just about patients. Doctors not dealing with cancers also have a very high threshold to think that it's cancer. And a lot of the patients, because of this high threshold, the younger women especially, there's a huge delay in diagnosis from the time they have presented to the, say the general physician or the GP, to when they land with us. There's a huge time lag and time lost because the threshold for suspicion of cancer is very, very low, and people don't think it's cancer because somebody is very young. But I think always the best thing we can do is evaluate them completely and prove it's not cancer, and then let it be, than just reassure. And it's very easy to reassure a patient and say, look, you don't have cancer, go, you're fine, go. But there will be a small set of patients who are going to be lost because of this. And because of this, we see a lot of younger patients coming to us in stage 3 and stage 4 breast cancer, because people have not suspected that it's cancer, though they have gone to the primary level doctors and it's been missed.
Thanks. So maybe just again, maybe adding on this only in terms of the screening programs for cancer. So is there something, a separate program for women less than 40 and more than 40? Is there a different protocol? So normally, what's your advice? Yeah.
So screening programs are usually recommended for women above 40 with a routine mammogram once a year or once in 2 years. For women less than 40, we say, see, there was a lot of talk about self-breast examination as a tool to detect early breast cancers. Extensive studies done, enough data to say women do not do self-breast examination. Though it's been advocated, people do not do it. And that, for that simple reason, we don't talk about self-examination anymore, because how much ever we try to emphasize about self-breast examination, women don't do it consistently, and their consistency is what is important. You have to do it month to month. So we talk more about breast awareness, meaning to say, what your breasts look and feel like, and any new change, anything different needs to be evaluated. For women above 25 years of age, we say a clinical breast examination once in 3 years is important. It could be important to detect small lesions and used as a screening tool. For otherwise women above 40, I would say screening once a year is important. And I think for younger women, especially between 40 and 50, we have some data telling us, more frequent screenings instead of once in 2 years. Once in a year is important, because for younger women, cancer develops, they're more aggressive. So they grow a little faster. So the preclinical stage, meaning to say when the tumor is there in the breast to when the women would palpate the tumor, is much shorter than for older women. So I would say for younger women, once a year screening. For between 40 and 50, maybe for women after 50, once in 2 years, we can recommend screening.
Oh, thanks. I think this will clarify a lot of questions that I see normally from women and even from the men folk. So thanks a lot. Maybe I'll give maybe a minute each to start with Dr. Anurita. Any take-home message to the audience or to even us, that what could we do in the days to come?
Sure. So absolutely, to the audience, I would say if there is 1 or 2 messages that they should take home, is that the fact that cancer can affect anyone at any age, right? And especially for women, yes, mammogram is recommended for above 40. So if you are above 40, please try and get yourself examined at least once every year, or once, with a mammogram once every year. Please visit your nearest hospital, ask for that, and consider this is important. This is a responsibility that women should owe themselves, more than anyone else, right? And for all the men folks out there, they should, of course, go back home, talk to their spouses, their sisters, their mothers, and encourage them to go for these screening programs in whichever capacity is possible. So that's the take-home message for all of us here. I think we should continue to do this as our duty, because we understand, we've been part of the either treatment or research or the pharma or corporate or hospital. And I think beyond our jobs, right, we have a responsibility to the community. And this is our responsibility in our small ways. So we should continue to do that. And for that, I think I would really like to congratulate the Cytecare Hospital. If there is anything else that I can do, I'll continue to support that. So that's in short from me.
Thanks a lot for these words, Anurita. We'll definitely reach out to you. I mean, your passion to kind of spread words about this disease and be involved in such sessions is really actually very encouraging for us. So, Dr. Poovamma, as we are talking, I know you are just about to fly to a different country and spending some more time in raising awareness about the disease. So, hats off to you. But any specific message that you want to pass on?
Yeah, I think to women all over, we are responsible for our health, and our health is important. Many women, when they land up in OPD, they say, if I fall sick, the entire family is going to be in a soup. And that's I think the truth, which is quite, that's something which is known. The woman is the backbone of the family. And I think it's better to take time out, half a day a year, to get a screening and, if possible, say, detect cancer early, than to land with the stage 3 or stage 4 breast cancer, where survival rates have drastically come down. The amount of treatments required is much more. You're going to be in and out of hospital, compared to, say, a stage 1 breast cancer, which is completely curable with excellent 20-year survival rates. So I think the take-home message should be, anyone can get cancer, and that's another myth that I don't have family history. People always say, I don't have any family history, and I'm saying, very very small percentage of cancer patients do have family history. It's mostly lifestyle. So anybody can get cancer. The most important thing is to detect it early, treat it completely, get the complete treatment recommended for you for the type of cancer you have. And there's nothing to be, to dread about cancer. I think we should remove the taboo associated with cancer. I think that's what is important, to remove the taboo, because even at workplaces, people are frightened to go back, tell your employer, I have cancer, I need treatment for 6 months, I'm going to be in and out. And I think from that perspective, MNCs need to be more supportive of their employees. It's a brief duration of treatment. I always compare it to diabetes, and I say, cancer treatment is brief, maybe, spread around 6 months, compared to a diabetic who has to take treatment lifelong. So there's nothing to be, dread about cancer. It's curable if detected early. The keywords are detected early, and that's why screening is important, I think.
No, very valid point. In fact, that reminds me of, one common saying by one of our senior doctor, Dr. Menon, who always say, most of the diseases are manageable. Cancer is one of the few diseases actually curable. It's just that you need to detect early in many of the cases and need to focus. The correct treatment or treating in the right way. So maybe Ramu, the last word to you, and maybe a vote of thanks from you.
Yeah, thank you so much, Amit, and everybody, Dr. Anurita. I think that was very, very nice of you to be part of this program and to say that you're willing to help. And I think as a leader of the industry, I think this is something that is very, very inspiring for us. And Dr. Poovamma, I think you always led the way in terms of doing so many awareness sessions. I think we will continue to invest our time and effort in this, and we will partner a lot more. I think the takeaway for me is to partner a lot more with other organizations and reach out to people and like-minded people to see how we can spread the message of awareness. And we have many screening programs, when we have literally hugely discounted it so that it doesn't really hurt the pocket, so that people can get the benefit of that. And we will do a lot more of that, Amit, in terms of the coming months. Definitely, I think awareness and sessions like these will continue to do a lot more.
So thanks, Ramu. And once again, thanks, Dr. Anurita and Dr. Poovamma, for taking time out. Really informative session, and I'm sure a lot of us will not only benefit in terms of kind of maybe knowing some more facts about this disease, but also it will give us some push to reach out to all the more stakeholders, all the more corporates, as Ramu mentioned. So we'll definitely work towards it, and we'll reach out to you for any possible help.
Thank you, Amit, for greeting and doing great session. Thank you so much.
Thanks everyone. Thank you.
Thank you.
Thank you.
Thank you. Thank you. Bye-bye.